Aloha, I'm Representative Kymberly Pine, and thank you for joining us with Time with Kymberly Pine. We have a great show for you today, and we're going to talk about the state of our hospitals here on Oahu. After the unexpected closure of Hawaii Medical Center, our medical systems here on the island of Oahu were stretched thin in many ways, but we have some wonderful people here today that will share with us the things that they've done to help the rest of the system to survive this tragedy that has occurred, especially for the people of the Leeward Coast. We have today here George Greene, who's the President and CEO of Healthcare Association of Hawaii. And we also have Dr. Virginia Pressler, who is the Executive Vice President of the Hawaii Pacific Health. Thank you so much for joining us today.
My pleasure, Representative.
Absolutely.
So tell me about what happened right after the closure of the hospital. What were the first things that your industry did to manage this problem?
Well, if I may, we worked in conjunction with the state to try and make sure that those patients who remained in both HMC and HMC East and West found homes, found places where they could receive care. And I have to commend all of the hospitals across the state, really, and all of the long-term care organizations across the state, because they stepped up in some cases, not knowing if they were going to be reimbursed for services, not knowing really what condition these patients were in, and they still opened their doors to take care of them. And it was a coordinated effort. Again, lots of phone calls, lots of emails, lots of sitting down with representatives of the administration and the legislature to talk about what needs to be done and how can we do it most efficiently. And I think it was truly a coordinated effort that helped to take care of those patients in need.
Dr. Pressler?
Yes, I think as George said, everybody stepped in to help out between the city and county, increasing the number of ambulances so that they could keep the response time as it needed to be, and all of the hospitals pitching in to take patients as necessary. We had huge increases, as you could imagine, at all of the emergency rooms. That still continues today. Our system is certainly being stressed, and yet everyone has stepped up, and we've averted a crisis because everybody stepped up to the plate to do what they could to help make sure the patients were taken care of.
Well, we recently had a town hall meeting in the Kapolei area for the Leeward Coast residents. They, as you can imagine, had high anxiety during this time to lose our one hospital on the Leeward Coast that had an emergency room. It really elevated the worries of especially parents who had children. And it didn't help that the day after or the week after they closed, we had a motorcycle accident right in front of that hospital. But of course, with the individual that most likely would not have been able to be saved. So we did have this town hall meeting, and what we've learned from the town hall meeting that was held in February was the amazing work that you folks did in the system, and we definitely want to commend all the different hospitals who did step up to the plate to help. We especially want to help or commend the ambulance services who worked very closely with the state and the city. And we, of course, are doing a lot of emergency appropriations right now to increase the ambulance services, and so we want to thank you for the efforts you folks have done to help us. So with that now, we know that we are pretty much surviving in the level of care that we need to provide, and if there is a crisis, we may not be able to handle it. What are the steps that we need to now take to ensure that our health system is where we want it to be?
I think this is an excellent opportunity for us to take advantage. We averted a crisis, we all stepped up. This is not sustainable long term. In the short term, we're okay. We've added 100 staff employees to Puuloa Medical Center. We've added 12 beds temporarily. There are a lot of things that people are doing on an interim basis in order to make sure we can take care of all the patients. Over the longer term, we need to make some fundamental changes in the way we provide care, the way we reimburse for care, the way we take care of our patients who are ready for discharge that need to go into post-acute care, but there's no place for them. And so I think George could probably address many of the bills that we have in the legislature this year that we've been talking about for many years, and shame on us if we don't take advantage of it this year to make the fundamental changes that we need to do to make sure we have a sustainable healthcare system long term.
Yeah, Dr. Pressler makes some great points. We absolutely have to change the current way we deliver health care in our state. And as Dr. Pressler noted, the Healthcare Association of Hawaii has sponsored what we call a sustainability package. And I've got my cheat sheet here. I'll run down a few of the bills. But as Dr. Pressler mentioned, with the implementation of the Affordable Health Care Act at the federal level, we're going from a healthcare system that is no longer going to pay for volume or throughput. We're going to be paying for quality outcomes. And we need to have a system that raises quality across our state so that we can improve our opportunities for reimbursement. We also need to take advantage of those opportunities to draw down federal dollars that do not require state money or taxpayer money. And I'll repeat that because there's a huge opportunity in front of us to improve the provision of care that we provide specifically to the Medicaid population. And HMC West saw about 30% Medicaid patients. And so this program, which would take no state money and again no taxpayer money, we think is the highest priority for our organization, and it should be one of the highest priorities for the state in this legislature. So a couple of the bills, if I may. The first one is SB 2083. And it's the first bill in our sustainability package. And this is a bill that allows for a general fund appropriation in order to draw down $10 million in federal funds to go to our private hospitals to recognize the care that they provide to the uninsured and the underinsured.
Is that when the state puts in the $10 million and then
Yes.
you get the federal?
Yes. In recent years, because of our budget deficits, the state has filed an amendment with a federal organization that allows for the use of certified losses to draw down those funds. So at the end of the day, we're in complete agreement that we have to use our state funds in a manner that best meets the needs of the state and also can serve the healthcare population. And by using those certified losses, at the end of the day, it won't use any general funds, but we'll still get that $10 million in federal funds. And that's very huge for our private facilities who take care of patients. The bill that I mentioned earlier is what we call our hospital sustainability program. And on the House side is HB 2275. On the Senate side, it's SB 2467. We are one of only 4 states not taking advantage of this federal program. And there are some risks involved for hospitals because the way the program works is we're allowed to assess hospitals a fee. So the hospitals would pay an upfront fee that would flow through the state to the federal government. The federal government would match that fee, and then the funds would flow back through the state to those providers of care to the Medicaid population. The risk, of course, is in the flow of the money. And so as we go through the legislative process, we're seeking, and to the credit of the legislature, we're getting assurances that that flow will occur correctly. We are having some challenges with our Department of Human Services because in our version of the bill, we realize that there may be some administrative burden on the state. So our members have decided to concede 5% of the fee to the state. Unfortunately, the Department of Human Services has stated that 5% is not enough. And so we're currently in negotiations with them. But again, because of the support from the legislature that we're receiving, we're confident that the bill is going to move forward and we're going to be able to hold to that 5%. And at the end of the day, get that funding back to providers of care who are taking care of the Medicaid population.
Is that something that you can take the state out of to manage it, or is it a requirement through the federal government that the state has to manage that fund?
It is a federal requirement that the state has to manage that. And one thing I would add about that program is that when you look at the closures of HMC East and West, as I mentioned, 30% of their population is Medicaid. Currently, our Medicaid reimbursement pays about 70% of cost. The national average is 89% of cost. If this program were implemented in the manner envisioned by the association and our members, we would raise that Medicaid reimbursement to about 83% of cost. So hospitals would still lose money, but they lose a little less.
Yeah. And that could be the breaking point for maybe hospitals like HMC.
Yes.
That's right.
And it would make the purchase of those facilities more attractive to a buyer. Because when they look at 30% of their book of business, instead of getting 70 cents on the dollar, you're getting 83 cents on the dollar, which may nudge them to go ahead and make that purchase.
And ultimately, we need to transform the way we provide care and also the way we reimburse for care. But in the short run, these are federal dollars that we should be taking advantage of to help relieve that burden on the hospitals right now. I mean, that was one of the reasons the Hawaii Medical Center's closed, and all of the other hospitals are still facing that major shortfall in reimbursement from government payers. So this is one way to try to not eliminate it, but at least to alleviate that burden on the hospitals.
What's the total loss of all hospitals every year? Do you have that number for that?
The most recent figure, and this does not include the state hospital system, is a little over $70 million.
Wow.
When you include the state hospital system, it's over $100 million. So it's a significant amount of funding. And these are organizations that have to reinvest in infrastructure, invest in their staff, invest in technology for patients, and obviously technology is constantly changing and improving. But when you accrue losses of literally over $100 million a year, it's hard to do those things.
What are the other bills you folks are watching?
Well, besides the hospital sustainability bill, we have a sustainability bill for our long-term care members as well. Same principle as the bill mentioned before, and the bill numbers are HB 2274 and SB 2466. One difference is that when you look at long-term care facilities or nursing facilities in our state, 70% of their business is Medicaid. So you're looking at 70% of your business being based on that 70% of cost. And so this is, in some ways, even more critical for them, especially when you look at the fact that we're the fastest aging state. When you look at the average age of our patient population, it's a lot higher than that of the mainland. So our nursing facilities are going to play a critical role in the continuum of care for us. So this bill is extremely important. Then we have two bills to deal with what we call the wait list problem. And the wait list are those patients who are stuck in acute care beds, so in a hospital, when their level of care has been downgraded to the point where they could be in a nursing facility or some type of post-acute bed. But because they can't get their eligibility approved by Medicaid, or because there's no long-term care bed available, they're stuck in this acute care bed. And as you would imagine, the cost of providing care in an acute care setting are much greater than those in a post-acute care setting. So we have two bills that would, one, provide what we call presumptive eligibility for those people who are on the wait list, which would allow them to move into that post-acute care bed when it's available. Then two, we have what we call wait list reimbursement. So if they are given presumptive eligibility and there's not a bed available at that time, their level of reimbursement would not drop from an acute level to a subacute level. It would drop to somewhere in between to recognize the fact that it's much more expensive to provide care in an acute care setting.
And those waitlist patients are important for a number of reasons. One is the reimbursement. Once a patient in our hospitals at Hawaii Pacific, at all the hospitals, are deemed ready for discharge, Medicare no longer reimburses the hospital. We get paid zero for those patients who are taking up our acute care beds. It's not good care for the patients who deserve to be in the appropriate setting where they can get their rehabilitation and their family members in a better setting than being in a hospital bed. So it's not good for patients. It's costing hospitals money. On the Medicaid side, we get paid about 20 or 30% only of cost instead of 75% of cost once they're deemed waitlists. And then the other thing is that those waitlisted patients, they represent about 10% of the census in our hospitals every day across the state. So at a time like right now when all of our hospitals are full and we have patients that need emergency services, if these patients, if we have our hospital beds taken up by patients that should be in another setting, it just doesn't make sense. So it's just a win-win-win-win. If we can do something to alleviate this waitlist problem, it's better for everybody.
Are you excited about the talks about turning Hawaii Medical Center East into a long-term care facility?
Yes.
How will that help the system?
Well, that will help build additional capacity. It will help build opportunities for patients to be in a more appropriate setting. I don't know what exactly the sisters might want to do with that, but I would imagine it could be a comprehensive complex for patients. That would include inpatient, skilled nursing, maybe a step down, as well as daycare and hospice and other palliative services, all kinds of comprehensive services so that we can provide better care of our elderly.
And that'll save the state money as well. What were they saying that we're losing every year by not having that type of facility?
It's
about 70 million
yeah,
a year.
it's anywhere between 60 and 70 million dollars a year.
Yeah.
Couldn't believe that figure.
Yeah.
And I think Dr. Pressler hit on a key note. As we saw the closures of HMC East and West, and as we tried to address the needs of those patients, you find as you transition some of those patients into the post-acute care setting, even though they no longer need acute care, they have complex issues.
Mm-hmm.
And HMC East could be a facility that's developed to deal with some of the most complex post-acute care issues that we're facing. And we think it would be appropriate.
Yeah, patients, for instance, that are on ventilators or they're on dialysis, or patients that are morbidly obese or have infectious problems or mental health problems. There's a whole number of different reasons why we can't place these patients in a normal home care or skilled nursing facility who isn't prepared to take care of the complicated patients.
So what do you think can be done after this bankruptcy goes through? What are your hospital's goals?
Well, certainly we've been interested in the care on the west side for a long time. We think that there is a need for a community hospital on the west side. We would very much like the opportunity, once the bankruptcy's settled, to discuss the possibility of acquiring the facility at the old Hawaii Medical Center West. And given our proven healthcare model, that we know that we could very efficiently and appropriately provide outstanding care to the people on the west side of Oahu that's consistent and seamless with the care that we provide to the rest of our patients. We put in the information systems, we would put money in to renovate the facilities, and that would take some time, but what we would do first is try to get the emergency room at least, and maybe imaging, and maybe one unit open as soon as possible, so that we could start making the folks on the west side feel a little more comfortable that they did have acute care services in their community.
What would be, I know this is so premature, but we want to dream big on the Leeward Coast. What would be your ideal facility? Would it be to specialize in a particular area, or would you remodel it differently that we've never seen before in the industry?
I think part of what we need to do is a needs assessment of what that community needs, what is appropriate for that community, and then what things can we link in seamlessly through electronic systems and all to make sure that patients have rapid access to other specialized services that they might need that maybe can't be provided cost effectively in that particular community. With the electronic systems that we have right now, it doesn't matter where you are. You can have communication with both the primary care as well as the specialists that you need in a timely manner. And we're having such fun with our patients who are now active members of their healthcare team, where they have electronic access to their records and they can communicate with their physicians, and they know what their blood pressure is and their cholesterol, and we can have them be active members helping to improve their own health.
So what kind of things in the healthcare industry can we continue to try to change to improve the system?
Well, again, I think one of the things that we have to do in our state is really look at how we're performing quality-wise. At the federal level, they're setting benchmarks for quality improvement so that they can begin to implement how they're going to reimburse for care. And so at the Healthcare Association, we've developed a quality committee that has quality professionals from all of our members sitting around the table and discussing best practices. Again, I'd like to give a nod to the legislature, because we had a bill passed and signed into law that protects the conversations of those individuals sharing those best practices. And I really think that that should give a hope to the people of the state, because you've really got the people who on a day in, day out basis are trying to work on quality issues within the healthcare provider organizations across our state, talking about how can we get better. And as we get better, we're going to get more reimbursement. With more reimbursement, we can invest in technology, we can invest in infrastructure, we can invest in our teams. And we truly believe as we raise quality, we're going to have the best healthcare system in the whole country.
That to me is the exciting thing about where healthcare is going, as we transform care so that we're paying for quality outcomes as opposed to just more procedures and throughput. And so patients are going to be healthier.
When you say quality, I know you can't go too into the detail. What are the general terms? Like for someone like me that doesn't understand what that means in relation to healthcare. What are some examples?
Well, it starts out by making sure patients are getting the right care at the right time, at the right place, but to be specific, for instance, say a diabetic patient, to make sure that they're active members of their healthcare team. They know what their blood sugar is being optimized, they know the other things that they need to do with their activities and their diet, and they have a whole team that's coaching and working with them, and so that they can be active members in improving their own health. And they can see online their own blood sugars and blood pressure and weight and things, so they can track it and feel good about, oh, look, my healthcare team, my doctor told me to do this and increase my activity and change my diet, and look, my blood sugar's down. So that's going to reduce the number of blind patients later. The loss is going to reduce the number of kidney failures. It's going to reduce the number of people that have to have amputations because of their diabetes.
And that's something your hospital has implemented. When did you start doing that?
We started doing that about 3 or 4 years ago with My Health Advantage, and it's been extremely successful. And I'm very, very pleased to see the progress that we've made in actual improvements in outcomes for our patients. And this, to me, is the future of healthcare, which is very exciting.
Can patients go online and see how they're doing, or do
Yes.
they only see it at the hospital?
No, they can do it on their smartphone.
Oh, wow.
They can be in Guam, or they can be in Wahiawa, and they can see on their smartphone what their latest lab results are, and make appointments and communicate with their physicians.
So if they had a cheeseburger week and they go to the doctor, they'll know why.
That's exactly right, and that's what we're finding with our patients now. That being active members, they can say, "Oh yeah, I know, doc. I know why my blood pressure went up, or why my blood sugar's not as good. I kind of slipped off my diet a bit." And so, that kind of immediate reinforcement helps patients be active members in their healthcare team.
Why do you think it's taken so long for us to get to this point?
I think it's because we didn't have access to the data, the electronic connectivity. It's been a major, it's a tool. It's not the solution, but it's a tool that's allowed us to provide better care for people, because we can get the information we need and we can share it with patients in a timely manner. That's part of it.
I would also say, when you look at the way healthcare has been reimbursed historically, the reimbursement was for volume.
Correct.
The more patients you see, the more procedures you prescribe, the more payment you're eligible for. It wasn't geared towards quality outcomes. And I think that there are a lot of people who rightfully have some issues with the Affordable Care Act. Nothing's perfect. It needs to be improved. But paying for quality outcomes instead of volume, it's a major step forward, because at the end of the day, that means people are going to receive better care. The right incentives will be in place. So I think that's a major reason why we didn't have this in place before.
The payment system has been providing the wrong incentives, and so now that's changing, and that's all very good.
Well, I think the quality care, and I think what was positive about the healthcare bill was that both sides agreed on that particular issue, and maybe that's why it made it in. Well, we want to thank you folks so much for coming. We just have a few more minutes left. Is there anything else you want to leave the audience with, and what we can do to support your efforts?
Well, I'd like to reassure your community that, in fact, we had a potential crisis. It was averted because everybody stepped up. We're going to look after the community. That is an important message that, the Healthcare Association, the city and county emergency system, everybody, is there and steps up when needed to make sure that patients are taken care of. And we are very committed long-term to make sure that the right services are available in that community again.
I would mirror Dr. Pressler's statements. Your community should know that even though there was a crisis and the crisis was averted, there are organizations such as HPH, such as the Healthcare Association of Hawaii, who are fighting for their right to continue to receive the care that they deserve. We're putting programs in place, we're supporting legislation, we're supporting policy that we think is going to improve the healthcare delivery system here in Hawaii. And they can find out any of this information that they'd like by going on our website, www.hah.org.
Okay, so www.hah.org.
Yes.
Oh, George and Dr. Pressler, thank you so much for joining us. We're just so honored that you care about us so much on the Leeward Coast and the rest of Oahu, and and we're appreciative of all your efforts that you have done to fight for us little people out there in society to make sure that we stay healthy and have proper health care.
Thank you, Representative.
Thank you.
Thank you. And I want to thank all of you again for joining us for this segment of Time with Kymberly Pine. Our next segment will be about education on the Leeward Coast and some of the really interesting things that we're doing on the Leeward Coast, particularly in the Campbell School Complex, to improve your students' education as well as their test scores so that they can compete in the rest of the country. Thank you again for joining us. I am Representative Kymberly Pine, and I will see you next time. Mahalo and aloha.